Hi, I'm Dr. Thuy Ahn-Melvin. I'm 38 years old and I'm a head and neck surgeon. As a head and neck surgeon, I get to use all aspects of STEM in my work every day. So when you think of a doctor, many times you see a head mirror, and we are the doctors as head and neck surgeons who wear the head mirror, and it helps us be able to look at someone's throat and shine light that reflects off of this mirror into someone's throat, and at the same time look through a hole. So this uses properties of physics in order for us to do an effective head and neck exam. One of the body parts that I specialize in is the ear. A coarse way to examine the ear is by using a tuning fork. This tuning fork is 512 hertz. That's within the frequency of sound that humans hear. When I activate the tuning fork, you can hear a sound. It allows me to determine how well a patient hears through their bone or through air. Interestingly, bone conducts sound much better than air, and that's why our inner ear is encased in the hardest bone in our body, the temporal bone. However, the world is made of air, so we as humans have developed ears that convert some of that energy from air into the bone in our heads. As a head and neck surgeon, I also get to use advanced technology in many aspects of my work, including examining patients. For instance, when examining the ear, I use a microscope, which allows me to see with magnification and also with very strong, bright light in a very small space or part of the body. In the operating room, we operate in sterile conditions, so I have to wear special gear like a face mask and a cap. And also, to see better, I wear a headlight, which is a fiber optic light that allows me to have very bright, strong light to see my surgical field, and also magnifying loops that allow me to see small things a lot bigger. One of the surgeries I perform is a cochlear implant. Some patients can't hear, and when they can't hear, there's a sensor that's not functioning correctly. With a cochlear implant, we are replacing or substituting that sensor with a piece of advanced technology called a cochlear implant device. This device works by using a microphone to pick up sound and translating that sound into electrical impulses that interfaces with the cochlea, which is part of your inner ear. And those electrical impulses go from the inner ear all the way up to the brain, and therefore you're able to sense sound. As a head and neck surgeon, I use my STEM skills in everything I do every day. Before surgery, I got interested in STEM as a child with math. Math became my favorite subject, and in fact, math was one of my hardest classes in my 12 years of grade school. That class I got the lowest grade in, and I didn't let that discourage me. I still went ahead and took the advanced placement test, and I got AP credit, which carried over to college. And in college, I chose to be an engineer. As an engineer, I get to apply my math skills in the work I do. In engineering school, I took some really challenging classes, including circuits and signals and systems. And then I realized the circuits and the skills I learned in that class can be applied to the body. And it was in college when I realized I really like working with people. So how can I apply my engineering STEM skills with people and work with people? Medicine became a very clear choice for me at that time. However, I wasn't prepared for medicine in college. I wasn't ready for medical school. So I took some time off and worked at a software company. And there I got to use the skills I had in college, all my engineering skills, my technology skills, my math skills, my programming skills. And during that time, I was able to apply my engineering background to my job, and at the same time apply for medical school. And in medical school, I realized I like to work with my hands. And I was able to combine my STEM skills with working with patients and people and using my hands through surgery. By combining my technical skills and my interpersonal skills, I'm able to be a successful female surgeon. A career in STEM can be very challenging, and that can be discouraging at times, but it can also be extremely rewarding. Always try hard, don't ever give up, and if you need help, ask for it.